There is something called meniscus, which is medial and lateral. Medial is a C shape, lateral is closed C shape or like a O shape, lesser than O. If this meniscus is damaged due to trauma or accident or some sports injuries or due to some of the twisting injuries of the knee, sometimes we will have to remove this. Most of the times we will fix the meniscus and we will save the meniscus. However, for some reason, if meniscus is removed because of inability to fix the torn meniscus, or if the meniscus is torn into multiple bits and pieces, then there is a procedure called meniscus transplant. This procedure is a boon to someone very young who is into sports, who would like to continue sports, and his knees or his or her knees are good apart from loss of meniscus. If all the other things are normal, like cartilage is normal, ligaments are normal, and only meniscus is absent, either medial or lateral, then we can consider this kind of person an ideal candidate for meniscus replacement. That is called meniscus transplant. The second most important prerequisite is to get the ideal graft. So this is usually harvested from the brain dead donors, will be preserved in tissue banks and bone banks, and in proper temperature and proper sterility precautions will have been taken. Whenever we procure it, we measure this particular person's meniscus and whatever the graft we are taking. When we measure it, we should be having the ideal same or little variation only in the size and width and the dimension of this meniscus. Along with that, we will check the cartilage status, ligament status, alignment status of the leg, and then we will consider this kind of procedure. This procedure is now has proven to be a promising one. If it is done with proper precautions and proper technique, then definitely it's going to be a very helpful for someone who would like to play and do his all activities of sports, and also he will be postponing the development of cartilage loss or cartilage damage, because these menisci are ones which gives support and cushioning effect to the knee joint. The message is very clear: meniscus transplant is available, and meniscus transplant is a skilled procedure, technically demanding procedure in terms of selection of the graft, measurement, other indication for procedure. So if everything is taken care, then definitely it has good results, and someone who is really in need of this kind of procedure can look into it and get it done. If this message or if this video is helpful, then like this, subscribe to my channel, and don't forget to share to your family and friends. Thank you.